Welcome back to Great Day Washington. This Week in Wellness is back with some great options for you and your family to consider if you are managing type 2 diabetes.
According to the Centers for Disease Control and Prevention, the condition affects more than 29 million Americans.
Wow.
Yes, here with important information are Dr. Tom Chaney, D.C., and Dr. Steph Chaney, D.C., of Living Health Integrative Medicine, and they are joined by Norman Wallace. Welcome all. Thanks for coming to Great Day Washington.
Thanks for having me. Thank you.
All right, doctor and doctor, tell me about this program.
Well, we effectively have been able to put together a comprehensive nutrition and supplement and lifestyle program that actually effectively reverses people's type 2 diabetes.
That is amazing. So this is really important because February is Heart Month, and I know that diabetes and cardiovascular disease are often two bandits in our bodies. So you can reverse this, and it'll help your whole body out. Is that correct?
Absolutely. And the number one killer for a type 2 diabetic is a cardiovascular event. So
Wow.
you know, it can be reversed with the right approach, and that's what we do. Is we take an individualized approach, look for the root causes of the problem instead of just treating symptoms.
Right. Norman, you had type 2 diabetes, is it?
I did.
Yes. How were you managing it before you met the two doctors?
Before getting involved with Living Health, I actually was on 2 different types of insulin. I was on insulin before each meal and insulin at night. One's long-acting and one's short-acting.
What was that like? You're taking insulin all the time, the drugs and everything?
Yeah, it was not very pleasant. If you think about it, if you're going out to lunch with a client or whatever, I would have to find a place which I could take my blood sugar, which would determine how much insulin I would have to take. So you find yourself in a public restroom or in the car or somewhere trying to take insulin and get yourself prepared to just simply have a meal, because the meal is going to, change your sugar level. So you have to take enough insulin to combat that. So it was just a very tedious process.
Oh, wow. And so how did you find Doctors Tom and Steph?
Well, I found them through a radio advertisement. My girlfriend and I were traveling from New York, and at that point in time, my A1C numbers were 10.5. I was on 2 different types of high blood pressure medications as well, and just was looking for a way to find out how to not live with diabetes, but they taught me that I could eliminate diabetes.
So you literally heard the call. Excuse me,
That's
Chris.
okay.
You heard the call and you answered it, really.
Absolutely, absolutely. As I just explained to you, the life that I was leading was not one that I wanted to sustain for a period of time. So again, this was a different thought process for me, because I always thought that once you had diabetes, you had to find a way to just live with it and make things happen based upon where you were. So this was just revolutionary for me.
When you start talking, I thought you were a doctor. I mean, when you have this, you start with the terminology, and you slip into that, and you're
They
taking
get
the
very well
drugs. Yeah, they
educated.
unfortunately they do, and that's the school of hard knocks, I guess, for lack of a better reason. Now you're taking the drugs away, and you're having how is it working? You're having their body heal themselves?
Yeah, we're like Dr. Tom said, we're doing some comprehensive testing and analysis to figure out what's really metabolically going on with that individual, and then we're creating an individualized nutrition program, diet, lifestyle program, supplement program, so that the body functions better and overcomes the disease process, and the reasons why the sugars are high are being fully dealt with. And over time, patients like Mr. Wallace are able to reduce and eventually eliminate their medications working with their doctors.
And Mr. Wallace, that was the result. You are no longer on medication?
I am no longer on any medication, and I've reduced my high blood pressure medication. I'm off one altogether, and the other one I've cut in half. I also had Crohn's, which was another debilitating illness. I have actually cut that medication in half as well. So my A1C was 5.1 at my last check.
There he is, the doctor talk again.
Yeah,
oh boy.
yeah. So,
Dr. Tom, Dr. Steph, you gave us a new man here. He's a new man.
Absolutely.
Good for you, and he's smiling. Good for you.
Yes,
Dr. Tom, where do we go for more information?
So you can go to our website, www.diabetesreversalseminar.com, or you can call our office, 888-514-4771.
Thank you, thank you, thank you, thank you for everything. And
Thank you.
Mr.
I
Wallace,
learned
thank you for
something
coming.
Thank you so
too.
much. Thank you.
Yeah.
Great information. And stay